Good afternoon, everybody, and thanks for joining us for this week's COVID-19 briefing. Note that there'll be both live captioning and ASL translation available today, and that the recording, as usual, will be posted later today. Today, we'll be able to go to about 2 p.m., and we'll get to as many questions as we can, and you could ask questions through the Q&A function on your screen. We'll be hosting these meetings bi-weekly moving forward on Fridays when there's no campus briefing. Michigan Medicine will be hosting town halls for the U of M community as well, so we'll be alternating. Today, as usual, we're joined by Provost Susan Collins, Vice President for Student Life, Martino Harmon, Chief Health Officer, Dr. Preeti Malani, and then we'll also be joined by Rob Ernst, the Chair of our Campus Health Response Committee, Sandra Cinti, the head of our Vaccine Safety and Effectiveness Group, Adam Loring, a physician in our School of Medicine specializing in infectious diseases, and each of whom will address questions in their domain. So just to get to the questions, I'm going to turn things right over to Dr. Malani. Preeti, it's all yours.
Yeah, thanks, Mark. And thank you, everyone, for joining us today. We're going to talk quite a bit about some of the health-related issues, both on campus and more broadly. So I'm actually not going to talk too much about what's happening with COVID. Rather, I want to talk about health more broadly and sort of some of the general issues around well-being. And, we know that stress is not something new. I mean, some of these feelings, particularly that students feel are things that have predated COVID, but clearly things have gotten more difficult and they've gotten worse. I think the isolation and loneliness really adds to some of the baseline issues. And, frankly, it's really disruptive to not have a roadmap in front of you, to not know when things are going to feel better or get better, and like, am I going to have a normal summer and things? So, I just want to emphasize the need to take care of ourselves and to really take care of each other, to find positive energy, positive relationships. And, I just also want to remind everyone that it is extremely disruptive. And I think some of our community members, our students, faculty, staff are having a difficult time. I do think it helps to name it and to acknowledge these difficulties. And reminder for the students, and we've talked about no door is the wrong door. Reach out to the Dean of Students office, the academic advisors, CAPS, the health service. There's a lot of great clinicians there who can help you. Your friends, your family, your parents. But if you're not doing well, please get help. We can help you. We can support you. We can listen. And encourage those around you to also get help. So I'm actually going to just move over to Dr. Ernst and talk a little bit. Rob, there's just been a lot going on this week around the variant and some of the changes on campus. So, I just was hoping, and that we can see here on the slides, can you provide an update on the B11 variant, so-called UK variant in the U of M community, and just really talk about what's happening, what's the status of things on campus?
Sure, thank you, Preeti. We're a couple of weeks into the semester, and we're seeing a lot of cases, amongst our groups that are both in the student community as well as the non-student community. This was one of the differences we saw with repopulating, was more activity in the general community. And while that has sort of plateaued out, we're seeing a steady increase in student cases to a point not dissimilar from what we saw in the fall, despite the lower density on campus and a dramatic increase in the amount of testing that we're doing. And not dissimilar from the fall, these are primarily attributed back to social gatherings. So that's kind of the pattern that we're seeing. Specifically, we are dealing with a cluster of cases that have been identified as associated with the variant strain that's been reported widely. In collaboration with the county and the state, we've enacted a number of containment changes in our strategy, including what we call a broader layered approach. So instead of just doing a case investigation and identification of close contacts, we're also extending sort of our quarantine to even broader connections and testing those folks specifically for the variant. We're going to hear more about the variant, I think, from Dr. Loring in a little bit. But the issue that we're trying to emphasize is that the variant probably gives us a a lower sort of margin of error. So if folks were trying to sort of not be super tight with their strategies for preventing spread, they're just not getting away with it probably. So we need to double down on the social distancing and universal masking. I think that's a really important message, and avoiding the gatherings. And these are sort of the drivers that our teams, in collaboration with the county, had suggested the stay in place recommendation could buy us some time. I've heard some of the experts characterize the COVID variants as fast COVID, and yet having to go back and reanalyze our specimens and sequence them for the variants takes more time. So we need to buy some time, and I think that's the rationale for the stay in place recommendation. The other is that we're really working hard to establish some of these testing recommendation or testing pathways to find the variant. And it's super complicated because we have different kinds of lab specimens, you know, whether it's the asymptomatic testing program through LINCS or through the diagnostic testing programs at Michigan Medicine or UHS. And this is really a time to encourage folks to use the U of M labs. So the one hole we'll have in the system for finding the variant is for those who are getting tested not at U of M, because we don't have access to those specimens. So, you know, it is a time to double down on our containment measures, avoid gatherings, wearing masks, keep your distance, and get tested regularly, but really use U of M labs. We have a lot of capacity in our system now to do testing, and we really want to put that plug in.
You know, Rob, just to follow up on that, I do want to emphasize that a lot of students are getting tested. So I don't want anyone to think that testing isn't happening. And the numbers you gave me, it was like 12,000 tests or something last week.
Yeah, we're exceeding those targets, and really have a better way of tracking the students' performance with the testing as well. We've updated our Responsive Blue app and encourage everybody to download that from the app stores or the Google stores and use that on a daily basis. All the undergraduate students have a different look and feel to the Responsive Blue than those of us in the non-student community, and it tracks their use of the U of M testing facilities, and we're able to report out, you know, on various groups, whether it's all students or whether it's students living in our residence halls or coming to campus for other reasons. And we can actually track back and see testing behaviors for students living off campus, and are going to increasingly be reaching out to those communities and encouraging them to get a weekly test as well. I can tell you, for students living in residence halls, we've had really strong uptake with the weekly testing requirements. Super proud of the students in those areas, and I know the teams in university housing and student life are working hard to encourage them to do this.
Thanks for saying that. I too am very proud of our students. I think this is not something that anyone would want to be in terms of situation, and I think they've really stepped up, and I see them holding each other accountable. You know, Rob, do you have anything else to add? This last question here is just the county recommendations, and I think you've touched on this. Anything to add?
No, I think it's again a moment to call out the ongoing partnership that the university has with Washtenaw County, and we've been also working with at the state level to get input on strategies to deal with this new wrinkle in the response to COVID. The variants present a real challenge to us because of the nature of spread and the concern that they're more contagious. So, you know, we've mapped out our strategy of this layered approach. So we really are fortunate that we've staffed up our case investigation and our contact tracing to be able to respond in a prompt way, but we need people to participate with that too, you know, so really cooperate and answer those phone calls and texts when they come.
My last comment, and then we'll move on to Provost Collins, is that the number I heard the other day, and I've kind of been in and out of the meeting since I'm busy with patient care this week, but the 24-hour, the number of cases that got investigated within 24 hours is just really off the charts. I think it's just a testament to the system and where it's been fortified, and really also our county partners. So, you know, I just want everyone to know that this isn't simple. And I think, again, they are really stepping up and doing this as fast as possible. So thank you, Rob. So we'll move on next to Provost Collins, and we'll talk a little bit about academic affairs.
Great, thank you. Delighted to
Great.
be here.
Yeah, no, it's great. And, we always have academic questions. So there's some really good ones. The first one is about libraries and study spaces. Are these available under the county recommendations?
And so quick answer is yes. The official statement is that students may access essential technology at the university designated study areas that provide for single person study space, and of course, strict adherence to the various preventative measures. So that includes computer labs, but also various resources and study spaces in our libraries, union and academic buildings. I do want to note that many of the spaces require a reservation, and some of them may have adjusted their hours. So we encourage students to check online for updates, and also they can reserve spaces that way. The spaces, they're not only important for the technological resources, but they're really essential as well for many students to provide spaces to log in for their remote classes, so that they can use campus Wi-Fi, and also having a quiet place to do work. So for all of those reasons, of course, and I have to reiterate, students should fill out the responsive blue before entering a building on campus. And of course, undergraduate students, as you've already noted, Preeti, have to get weekly testing to use those spaces. And we really strongly encourage our graduate and professional students to take advantage of the testing access and get weekly testing as well.
Great, yeah, and I know I looked at the website, the Study Spaces website, and there actually are a lot of spaces available. And for students that are off campus working fully remote, it's sometimes nice to leave your house. I know some of them they've gotten very comfortable, but it's good to get some fresh air and change of scenery. So I encourage you to do that. Next question is one that a lot of people are asking about, and will the university consider allowing certain positions to remain remote post-pandemic?
So this is really an important issue, and we're considering it both at the university level, but also at more local levels as well. And so I want to highlight that at our next briefing, which will be in 2 weeks, we'll have an opportunity to talk more and share out more information about the results of the Ann Arbor staff survey, which we completed in mid-December. And we were pleased to have really high participation rates, actually. The response rate was about 55%. And that feedback is really important in terms of the planning and the work that's going on, as well as the work that was done by the WISE committee, so Workplace Innovation and Staff Experience Committee. And those are going to inform the approaches that we'll take. And we look forward to having more discussion with the community as our planning and work on that proceeds.
Great, so it's a work in progress like so much else. Do you anticipate permitting faculty to travel to conferences this summer or fall?
And that's a question actually I get asked quite a bit. I think it's important to just raise that raises two separate issues. One is our travel restrictions that we imposed when the pandemic started. And the other is the restrictions that have been put in place by us, but also by others due to the health concerns. So the university will be gradually relaxing the restrictions on our expenditures as the financial position strengthens, and importantly, as some of that uncertainty is resolved rather. And we will be communicating out our plan for those relaxations in the coming weeks. So we'll be providing more information there. But most conferences actually continue to be virtual for the health reasons. And as we've heard, those are evolving. And so it's really difficult to say how much of that would be resolved and for the summer and even for the fall. So stay tuned, but there really are two separate aspects that are involved in answering that question.
Yeah, I for one am hopeful to start getting back to some of the infectious disease conferences maybe by fall. So we'll see. Will we be having in-person tours for admitted or prospective students and families? And if so, what are the guidelines that need to be followed?
So at the moment, the university is not offering in-person or guided tours for prospective or admitted students. And that's for the public, for the health and safety of the campus community and the public more generally. So of course, we continue to closely monitor and follow the public health recommendations. And when we're assured that we can provide a safe experience for the public with in-person and guided tours, we'll restart them. But we've developed a robust set of online resources for our prospective and our admitted students, including a virtual tour. And we also have digital maps for self-guided walking or driving tours. Encourage people to take advantage of those. But of course, please we ask all visitors to follow the public health guidelines, and that includes wearing masks on all university property and also continuing to practice the physical distancing.
Great. Thank you so much for that update. We're going to transition next to student life. Vice President Harmon.
Hi, Dr. Milani. How are you?
Hey, how are you?
Great.
Good to see you. So this is a question I get asked a lot, and I love to hear what you can say about this. Is what are you going to do to help first-year students struggling to meet new friends right now?
Yeah, this is a really serious concern that we heard a lot about last semester. And Student Life convened a task force late last semester to prepare for winter term. And their role is focused on making it easier this semester for students to find people, to make connections, to get engaged in a very safe way, whether it's virtual or whether it is in person and very safe opportunities. The best place to start to learn about it is to go to the Find Community page on the Student Life website. So I'm going to quickly mention 3 examples. It's a lot of fun. There's a program called Community Matters. It's a cohort program, and the sign-up deadline has been extended until January 31st. We've had a really strong response. So this weekend, sign up. And it really matches first-year students with a pair of upper-class student facilitators and with a small group. And that allows them to make connections and find community. So just Google Community Matters Cohort Program and UMISH, and it'll take you to the registration page. Second example is an opportunity for students to learn how to be financially savvy through the Flourish program. And that starts next week. It's a series that'll last throughout February with a different theme every week. And the themes explore dimensions of your well-being, everything from financial to physical health, and it gives you an opportunity to make new friends. So just search Flourish, and you can register at sessions.studentlife.umich.edu. That's sessions.studentlife.umich.edu. And the third example is while you're in registering for Flourish, there's another great program that students will want to check out. For fans of Queer Eye and the Learning to Cook program, CCI has an awesome event coming, which actually is tomorrow night. I need to get involved in this one, that you can register for with a program that features Antoni Porowski, and he'll be doing a cooking demonstration and a Q&A that will be moderated by student leaders from Big Ticket Productions. So that's a lot of fun. And I need to figure out how I can get involved with that program. And again, that's sessions.studentlife.umich.edu. The best part of all these options is that they're available to students wherever they are, whether they're in Ann Arbor or in another state or another city, living on campus or living off campus. So those are just 3 examples I wanted to mention.
Yeah, that's great. And just anecdotally, I know when I speak to students, the ones that really, I think, are having the best time the first years, they've found some activity that's just really engaged them. And so, I encourage the parents who might be listening in, to encourage your students to find something. It's not the same as being here in person, but it gives you some connection to a group. And let's talk a little bit about the county recommendation and how that affects some of the services and facilities for student life.
Yeah, so we're really focused on supporting students. We recognize that the pandemic variant, now a stay in place recommendation, is exhausting. It can be frustrating, and we understand that. But we also know that all of this is in place to help keep our campus safe and to keep students safe. And hopefully it's a short-term huddle to stay in place that we can get through and stay in a good position. So our departments are working on virtual and in-person where possible support for students. So I want to mention some facilities because there may be questions about facilities that are available. There are no significant changes in terms of housing or dining. Those services will be available as they normally would during the stay in place recommendation. But just, I will remind students to, 1, utilize your Responsive Blue to mask up, above your nose, not below your nose, and stay at least 6 feet apart when you're in the facilities. The Michigan Union and Pierpont will remain open to provide support for students' critical academic needs, primarily whether it's printing, study spaces by reservation, access to Wi-Fi if that's a challenge for students at their residence. And in addition, the union will continue as a site for the blood drive. The IMSB building is open for COVID testing purposes only. Again, make sure you use your Responsive Blue. The Michigan League, Trotter Multicultural Center, NCRB, and CCRB will be closed for the duration of the stay-in-place order. For specific hours for a particular building, just go to the website and you can find that information. And I know some of you might be pretty bummed out about rec centers being closed because physical fitness is important in terms of wellness, but you can continue to support aspects of your fitness by being involved with Group X and other virtual workouts. So you can go to recsports.umich.edu for more information about Google X. And finally, I'll just say it's important that students continue during these challenging times to hold ourselves and each other accountable to make sure that we are doing the right things during the stay in place and after the stay in place to mitigate the spread of the disease. And I'm confident that students will take this seriously and will do the right things. Thank you.
Yeah, I agree fully. In fact, I would say that, frankly, most of our students take this as seriously, if not more seriously, than a lot of the quote grown-ups in the community. So thank you for what you're doing. And I see this with roommates and how they navigate this and that shared responsibility and shared risk. So whatever the narrative might be, I know that they're working hard. So thanks so much, Martino. Thank you for your work and your whole team. So onward to vaccinations and my friend and colleague, Dr. Cinti. Sandra.
Hello, Preeti. How are you?
Good. Thanks for joining. Both of us are rounding actually. So this is
we are.
It's funny. I'll probably see you in the hallway in a little bit, but nice to join you virtually. Can you give us an update? I know there's a lot of questions on vaccination. We'll go through these questions and then whatever else you might want to add. So how many people has Michigan Medicine vaccinated so far?
So we've given about 43 to 45,000 vaccines since December 14th when we first started. About 28,000 first doses, and now we're starting to cycle through second doses. You know, we could do a lot more. We're limited right now by the amount of vaccine we're getting. And so it's a little bit frustrating, but we're ready and we will get more vaccine soon. So we'll be able to ramp up our efforts.
That's great. And this question I think has come up before. Will employees whose work requires them to be on campus and in contact with students be given priority over employees who are able to work entirely remote?
Yeah, so right now we're in this phase 1B, and 1B includes the employees that includes are the ones that have contact with frontline contact, meaning they can't stay they can't stay more than 6 feet away. So it would be the environmental services workers, the food workers, the transport workers, childcare workers. Those are all in the current 1B. 1C includes other essential workers, and that right now it's going to be a few months before we get to 1C. And so it's a little bit difficult to answer this question about other employees and where they will fit, because they could easily change depending on what the CDC says and what the state says. We really try to follow the state guidelines as closely as we can.
Yeah, and that 1B category, I think people probably recognize it, but it's like the bulk of people, frankly, that need to be vaccinated in a lot of ways. And obviously the younger adults are going to be a little different, but it's very different than the healthcare worker, the 1A healthcare and nursing homes. Which group phase do instructors teaching in-person lab classes fall in for vaccination? I think you addressed this a little bit with the last comment.
Yeah, right now I think we're talking, it's the phase 2, which is the phase of the general population. 1C possibly, depending on how that discussion goes. But right now, if people can do things distanced right now in teaching, the K through 12, and people may be confused because K through 12, everybody knows, are in this 1B category. But the teaching among universities, colleges, community colleges, those are still categorized in level 2, right? Phase 2A. I'm sorry, not 2A.
Yep. So higher ed and K through 12 are a little different. And then
yeah,
a few more questions. What's U of M's strategy for the overall distribution of vaccines, especially the second dose? I'm worried that there will not be sufficient supply for a timely second vaccine if I go in now.
So we are favoring, and we are favoring people in this setting where we're not getting enough vaccine. We're really favoring second doses. So we're giving everybody, we believe it's very important to get your full doses. So if you've gotten your first dose, you should be guaranteed a second dose. And as a matter of fact, we're not getting as many doses as we wanted this week. And so we're really going to be able to do all our second doses, but only probably several hundred first doses. So so you'll get your second dose. Yes.
Great. And, again, everything is nimble. Everything is, sort of changing. But right now, and I just want to throw out, please go get your second dose. I know some people are a little worried about side effects. They are short-lived and not that severe. And please go get your second dose if you've had your first dose.
Absolutely.
Can the university state whether they prioritize by age and health status or invite randomly? I think that's probably related to the 1B.
Yeah. So right now, what we're doing is, because one place that we want to be nimble, and so what we're doing is taking a whole group that's 65 and over among our patients, and we're randomizing those. Those are randomized. So it's been thought of as the fairest way to do it at this point. If vaccine supplies stay very limited, and depending on what the state says, we may have to change that strategy. But right now, it's not by age, it's by 65 and over, and we're taking a randomized sample and then sending invitations.
Yeah, and I want to acknowledge how difficult this is. I know my own parents. I mean, I'm dealing with this, trying to help them go through this with my in-laws, and it's frustrating. And there's this you see other people getting vaccinated, and but the supply is just not there. I'm hopeful that even in a few weeks, the supplies might look a little better, at least, and then hopefully a lot better. This question, I think, is a little more specific. Are there any suggestions for persons with MS or other immunosuppressive disorders for the administration of COVID-19 vaccine?
We would vaccinate that population, of course, and there's no reason to think that there's any kind of reaction that will make their MS worse or their immunosuppression worse. There's the only absolute contraindication, which means if you show up and you have one of these, you won't get the vaccine. And that's only if you've had the first vaccine and had an anaphylactic response, which is an allergic response where people's throat closes off, or if you've had to any components of the vaccine an anaphylactic response. But otherwise, this vaccine is open to everybody else, and these populations for sure.
Yeah, and in fact, the feeling is that these are important groups to get vaccinated, particularly people who are immunosuppressed.
Yeah, absolutely.
And again, their response may not be quite as good, which gets at the issue of why we all need to keep doing the mitigation even after we're vaccinated. So thank you, Sandro, for doing this superhuman work that you are doing. I feel like you're perfect for it. So keep it up.
Thank you for your work.
Oh, thank you. Thanks. And we're going to move on now. We have a new guest, a new person joining our lineup. This is Dr. Adam Loring. And I'm just going to take 30 seconds to tell you a little bit about Adam. He's one of my favorite colleagues, and he and I actually we give each other kind of a hard time, sometimes on social media, sometimes by text, but I think of him as kind of one of my younger brothers in the ID division. And like any big sister, I'm really proud of him and what he's done really around the pandemic. Adam, I always felt like your work around the evolution of RNA viruses, it felt a little obscure, a little esoteric for someone like me that thinks of pneumonia and sepsis, but wow, who knew how important your work would be at this moment? We're so grateful. I know there's huge demands on you everywhere. You're all over the place. But to talk about it, and I just want to say something that Adam probably won't share, but back in March, when we started to see our first patients, Adam raised his hand and said, "I'll see all the patients." And this was before we really knew about transmission and safety. He put himself out there, and Adam, I remember that well of you being gowned up and really seeing all those patients back in March before the big flood came through. So thanks for joining us, and we're going to talk about the new COVID-19 strain and what that means. I think we're referring to the B117. So I'm not seeing you on my screen, but I think you are here.
I'm here.
Oh, there you are. Okay, good. So tell us what we should know about strains in general, but I think we're talking about B117, which has been identified in our community. Tell us what it means in terms of more contagion.
Yeah, so thanks for having me here. So B117 is, of course, the one, it's a little bit of a mouthful. It's the variant or strain that's in our community, as you said. It's also one of the first kind of ones that's been discussed since, November, December is when it really came to light. And this is a strain that basically took over the United Kingdom and has caused a lot of illness there. And due to a lot of work that took place in the United Kingdom, we do know that it is more contagious. And by that, we mean that it spreads better. We don't know exactly why, but we do know that it does spread maybe from person to person in a more efficiently. And so about 50% better. And so that means that it's something that we watch closely, because we know it's something that in order to control it, we're going to have to up our game a bit. And so that's why there's been such a big response in the campus in Washington County since we discovered that it is here.
So, people are talking about contagion, and what does that mean? And, I think, again, Rob puts it really nicely, this idea that we don't have as much margin for error, and that idea of doubling down on what we know. But this is a question that came to us. Does the B117 variant transmit better through surfaces than the predominant strain, or I guess the wild type, probably?
I don't think we have any data that suggests that's the case now. It doesn't mean that things aren't going to emerge down the road. I think, what we know is that it just transmits better. I think most people suspect that it's still transmitting the same way as SARS-CoV-2 transmits, but it's something people are looking at. In preparation, I was looking over the CDC guidance last night, and there's really nothing there that suggests that we need to do anything different yet, but we need to do everything that we've been told to do that much better and be that much adherent, I think.
Big question on people's mind is, does the vaccine, and again, there are multiple vaccines, and of course we heard today about J&J's preliminary data and hopefully their EUA application coming soon, but does the vaccine work against the new strain of COVID-19?
Sure, and here's where things can get complicated, because there's actually in the news 3 different strains or variants that people have talked about a lot, and I'll refer to them by country, even though you're not supposed to. The UK variant, which is B117, which is again the one in Washington County. That so far all the vaccine data looks pretty strong against that, and so in fact the Novavax trial, which got released by press release last night, it's the latest vaccine to announce. That trial was done a large part in England while this strain was kind of around, and it appears to be worked just fine. There's also the variant that is similar but quite different in South Africa, and that one, the Novavax reporting was not as effective in the South African trial, and so, but it still was, I think 50% was the estimate of how well it worked versus 90% against B117. So it might be less effective, but still 50% is decent. And then the Brazil variant, as it's called, is similar to the South African one. There's not as much data on that yet, probably soon, but I suspect it'll be similar to the South African variant, just based on how it's behaving. But I think the message is vaccines work pretty well, and I don't, while we would like the news to be better, we know the vaccine works well against the B117, at least with the present data. and I think it works pretty good against the other variants. So, and I'm sure the vaccine makers are adjusting their plans as we speak.
Yeah, in a way, this is part of that unknown roadmap
Yeah.
that we talked about, and whether we'll need a booster shot or a different shot
Yep.
6 months from now. And I know that the companies are trying to be nimble to
Yep.
respond, but from a clinical standpoint, as we see people who are vaccinated, fully vaccinated, if they present with illness, I think that's when sequencing people, the kind of work that you've been doing really for months, will be really important to understand this. And with the vaccine, we talk about prevention and preventing of serious disease, and I think there's still a lot of unknowns. And it does get back to the fact that you said you don't like to use the country of origin, but these are countries where there's been a lot of uncontrolled spread.
Right.
What we don't have is a South Korean variant or a New Zealand variant. And so it gets back at the last question here, which is, how do we, the more communicable variants of the virus require changes in how we protect others and ourselves, such as increased attention to surface contamination or greater than 6 feet of distance. And I'm curious, Adam,
Yeah.
My understanding is that this is droplet, this idea of opportunistic aerosols, but that we're still going to see spread in settings that are social settings, that are unmasked, that are close together, but that with the mitigation strategies, we still can prevent.
Right. I think that's it. I mean, I think the game has changed, and as you indicated, and as Dr. Ernst indicates, I think I don't think the rules change. We just need to we just need to up our game, and the mitigation measures probably aren't going to change, but we just need to be that much better at wearing our masks, wearing good masks, changing them frequently, and then physical distancing, gathering size, all those things should still work. We have room to improve in terms of being compliant with them, and then of course as the vaccines reach more in the community, we need to be good about working with people to get the vaccines out, like Dr. Cinti is doing.
Great. Any last thoughts on? I know you've been everywhere, and you had a great paper in JAMA. You're gonna be joining JAMA for their podcast. You run a podcast. You're gonna join them to talk more about variants. So we're so glad that you could make time for the town hall today.
Oh, it's fun to be here.
Okay, great. I guess we're going to move on to some Q&A. One of the questions that's come up, and this one's going to be for President Schlissel, is just what's the state of recommendations regarding athletics?
Yeah, so hi, Preeti. As several people mentioned earlier today, we've been doing all our work very closely, particularly with the county health department, but also the state health department. And as this B117 variant was first identified, and we have found to have several people infected with that variant, the state issued a series of pretty strong recommendations, including a recommendation that we stop athletic practices and competitions. Their fear was that despite our best effort, this more transmissible strain is in our community. And athletics, by its nature, very often brings people in close proximity in ways you can't avoid. I'm a big basketball fan, and I watch the team all the time. And you can wear masks on the bench, but when you're competing, you're in close proximity to the other athletes and the referees and many others. So, that was the state's recommendation. We're following it. Otherwise, also in alignment with recommendation, the stay-at-home order. The idea applies to athletes as well as everybody else on campus to try to slow down the transmission of COVID, including the variant. And the way I think about the variant is if you're sitting in the room with somebody that has COVID-19, you might have a 50% chance, let's say, of becoming ill yourself from that person transmitting the disease. If it's the more transmissible variant, that same interaction might give you a 75% chance of being ill. So then, that's what's meant by something or being, 50% more transmissible than something else. So it's all we're playing the numbers. It's all an odds game, and I'm hopeful that the general levels of COVID on the campus will go down. I'm hoping we will not see any additional cases of this variant, which we haven't in a number of days. We've tested all of the positive samples on campus. or we're in the process of doing that in recent days, and we've had no more instances that I know of this B117 variant. And we'll be able to sort of pull back the stay in place and get back to a more normal COVID environment as opposed to this hypervigilant one. Hopefully we'll be able to get our athletic programs going again soon too, perhaps in another week or 10 days.
Yeah, and one thing, Mark, that I think is worth mentioning, that with athletics and across the Big Ten, I've said this several times, it's 11 states, obviously Michigan and then 10 other states. And, the idea of travel is a really big thing. It's been a big thing all along with the pandemic. And I'm sure that, these decisions are really difficult, but that idea of sort of pausing this idea of going to all these smaller communities and really creating outbreaks, like the idea that you'd have 11 states with outbreaks would be a really dangerous thing. So.
No, I agree with you. The travel is challenging, even as safe as we try to do it. And all the teams in the Big Ten are testing under the same protocols. They're testing their student athletes daily in most sports, and still this spread can occur.
Yeah, so this next question is just about an email or link to a web page, something summarizing the contents of the Zoom meeting. I think you're sort of doing that with your emails.
Yeah, every week we send out an email Friday afternoon usually. It summarizes what we spoke about in today's town hall, some other new information, a bunch of links, and then a link to the actual video of the presentation. So look for that in your email box this afternoon. And I apologize for all these emails. We try to use many modes of communicating with campus. There are some people that want to know more details. Some people want to know fewer details. Some people don't use email. Everyone wants to see social media. So we're trying our best to use as many modalities as we can, and just sort of try to bear with us.
Yeah, you see COVID in that subject line and you just, yeah. But so Rob, I have a few questions around testing that I'd like to have you address. There's a couple here, and then there's some that have come through the chat. So this is for Rob Ernst. Would you recommend staff and faculty members to continue getting tested via the CSTP? This is the Community Surveillance and Tracking Program after the second dose of vaccination should be in, quote, full effect.
Yeah, I think that there's a difference between having had a documented infection and having had the vaccine. And there's implications in terms of uncertainty. We don't know about risk for reinfection, but there's certainly implications about how those conditions can affect subsequent testing. So if someone, I saw it in the chat earlier, I'm going to just go ahead and address it, or the Q&A, that if someone's had a documented positive test, then they shouldn't be tested again for 90 days afterwards. It's not unusual to see a persistently positive even beyond an infectivity period. Now, if somebody's really symptomatic, they should get evaluated, and that can be a complicated evaluation, but they should not be getting tested. And the question in the Q&A was, yes, if you're an undergraduate student and you've been tested positive, that will link their response of blue as being green for those 90 days. And if a student was tested outside, they can upload those positive tests into the site, and we have a way of validating those and then make the change in the response of blue so that they will not show that they're expired on their mandates.
Yeah, thanks.
I was going to just address the issue of being vaccinated. We're still uncertain about what is the likelihood of asymptomatic carrying the virus. So the decision to get surveillance testing along the way is an individualized one after a vaccine. But if somebody's been vaccinated and identified as a close contact of a subsequent case, those folks will still be subject to quarantine potentially.
Yeah, I know that question's come up quite a bit with students. I know it's come up in School of Nursing in particular. I think, unfortunately, people have ended up, there's a few students who've been quarantined multiple times because of close contacts. And thanks for answering the question about the outside testing. I know people have questions about that. And, again, I just want to emphasize that please get tested within our system. It'll make it a lot simpler. It's super convenient. It's you just sign up and show up, quick and easy. For the community sampling and tracking program, is your goal to have people come every week, regardless of exposure and symptoms, or are you simply making testing available on an as-needed basis?
So it's an important clarifying question too, is that remember the community sampling and tracking program, this is the saliva-based assay, is for asymptomatic people. So if somebody's worried about an exposure, or if they're having suggestive symptoms or symptoms suggestive of COVID, they should seek medical attention for that. So any student who's worried about symptoms and thinks they might have COVID should contact UHS, not just try to figure out how to get tested on their own through the saliva program. Similarly, a faculty or staff member should contact occupational health services, because these are different kinds of assays, and we also like to separate those populations just for protection purposes. We are, for instance, in this layered approach to figuring out where we are with the variant, for instance, we're quarantining certain contact groups and then retesting them at specific intervals as outlined in the recommendations by the public health folks. And we're doing those on the UHS test platform. That gives us really ready access to those specimens to do the more detailed analysis for the variant if we have positives in those groups. So that's there are different recommendations.
Yeah, it's and you know what? 2 weeks from now, they'll probably be different again. So stay alert, and thank you for everyone's patience. So thanks so much. Question for Sandro. I'll be 65 in April. Should I resubmit the blue Q after my birthday?
That's a good question, and the answer is the answer is yes, because you'll then be in a higher risk group. Yeah, absolutely, because that'll put you in 1B, 65 and over.
Yeah, and probably we probably won't be through 1B in April, so get ready, I guess.
No, I don't. Well, it'll be close. Yeah.
Okay. Yeah. Well, I guess we don't really know, so that's good. So Susan, this is a question for you. Is there a recommendation to pause in-class teaching if the class can be delivered via Zoom?
So the answer to that one is no. And this really builds directly, Preeti, on what you and Adam said earlier. And that is essentially that the strong recommendation is to double down on the protocols which have been working very well in our classrooms. And so in that context, continuing with in-person classes really makes sense. And so that's what the approach that we're taking. As always, if an instructor has a concern about a class that they're teaching, they certainly should work with their unit leaders to address that concern.
Yeah, and this is something that there's a reason that the stay in place recommendation carves that out, and it has to do with the experience. And frankly, in the fall, especially when we started, we just didn't really know what this would look like. But more and more and more, we have experience that shows that the way the classrooms are set up, frankly, are just, they're safe. They are as safe as a lot of the very low risk things that we do outside our home. So that's good news. So keep it up. There was a question, Adam, I think you addressed this a bit on the Brazilian and South African variants. And again, I know there a few days from now, there'll be another one. But what are the latest data on vaccine efficacy? Because I think that has been a little bit confusing, and you might have the up-to-date answer from this morning even on some of this.
Well, unfortunately, I read the newspaper this morning. So I saw the J&J's story, but I haven't seen anything more yet. And then the Novavax came out yesterday, and unfortunately, all we have is a press release. And so there's some data in there, but you really have to dig into these things. But yes, so the Novavax, again, the trial was a large amount in the UK and also in South Africa. And so what they found is, in the UK, where there's a lot of B117, that the vaccine worked quite well, around 90%, I believe. And then what they found in preventing, symptomatic disease. And then in the South Africa, where there was more of this South African quote variant, that the Novavax vaccine worked roughly 50% effective. There were kind of wide uncertainty and confidence intervals there. And again, symptomatic disease. There was no severe disease in any of the groups, which is reassuring. So it suggests that it might be less effective against this South African variant, which is similar to the Brazilian variant. But I think there's a lot we don't know. Is that because the variants are different? Is that because the vaccines are different? Or immune responses to the vaccines are, there's a lot we don't know, but certainly we'd love the news to be 90% against everything. It doesn't appear to be the case, but 50% is still pretty good. And it's also the silver lining is there weren't severe illnesses, even if the vaccine didn't protect you, from getting sick, period. So I think, there's half empty, half full way of looking at this, but and I'm sure as more data comes in, we'll learn more and more, but that's kind of where we are today.
Yeah, and I think
let me add a tiny bit to that. I agree with Dr. Loring that even a vaccine that isn't as effective is probably somewhat effective against these variants, just based on how the vaccines are made. And the other optimistic news is the way the Moderna and the Pfizer vaccines are made, it's relatively easy to create a booster shot, which would be likely to be better for the emerging variants, because it's just popping in and out genetic sequences. So although that isn't out there yet, I don't believe, I wouldn't panic and say, oh my goodness, it's likely that these vaccines will become worthless. They'll be partially effective, and there's a chance to tailor booster shots to newly emerging variants.
Yeah, and I think if you had asked us 6 months ago, when even we were sort of optimistic on vaccines becoming available, the thought was we would probably modify disease, not prevent it altogether. And again, Adam, this is a separate discussion, but we still don't know really, is it infection that's all completely prevented, or is it just severe illness, or can you still transmit? And maybe if we get this other study going on campus, we'll have you come back to talk about it. There is a question related to vaccines. Sandra, I want you to, I know you've answered this before, but this is something that continues to generate a lot of questions about the prioritization of Michigan medicine employees who don't interact with patients. Can you talk about how the state guidelines applied?
Yeah, those patients were placed in 1A, and that was at a time. So they're people who are patients. They're not patients. They're people who were placed in 1A at a time when we had quite a bit of vaccine, and we were at that time we had gotten through a lot of our 1A, and the state expanded 1A to allow us to bring other people in, and so we started to do that. Those invitations went out, and so we're still seeing some of the tail of that 1A. It's not that many people that are left, but yes. There, you will see young people getting vaccinated out there, and they may indeed be part of the system that doesn't see patients, but that is supporting the mission of our healthcare system. And they were put in 1A several weeks ago. So yeah. That's what you're seeing that.
Yeah, and I know there's confusion for people, but part of this is that you have to continue to move vaccine. You can't really store it indefinitely, and
Yeah, this is guidelines. Right. Very different from, say, influenza. I want to make 2 points here. One is that if we look at, so this is very different than flu vaccine that we can send to your doc's clinic, and they can do that. They can vaccinate there. We have to do this on a mass vaccination scale right now. And we've looked at models, and I think Dr. Schlissel pointed us to one of the models in Israel where efficiency meant you really had to move a lot of people through. It was the simplest way you could do it, was the best way. The other point I wanted to make about flu and efficacy, if we look at influenza, many seasons we have efficacies well below 50, 60%, and we still give flu vaccine, and it protects people. We did a study several years back where we looked at hospitalized patients who were pretty similar. One group got vaccine, one group didn't, and they came in with influenza, and the people who had gotten influenza but gotten the vaccine did better in the hospital. So I think that's going to be similar, and we should think about that also as we think about these variants coming along.
Yeah, great. And I'm going to have one last question for Provost Collins. Can students who do not feel comfortable going to in-person classes attend online without penalty?
So let me just provide a bit of context there. So if you look across our classes, about 82% of them are being offered remotely or hybrid. But of course, as we've already talked about, there are some classes which are being offered in person. And those include some classes that are really just very difficult to do well remotely. And so, as always, what we would ask is that any student who is unable to attend their in-person class really should contact their instructor to determine what the best way is to ensure that they're staying current with what the expectations of the class is. So that's really what the recommendation would be. Please contact your instructor.
Okay, and another quick one. How can people find out which vaccination group they are in? I think that's one for Dr. Cinti, if he's still there.
Yeah, the CDC website has all those. And what you can do is go to the Michigan Department of Health and Human Services COVID priority guidelines. That will tell us, that will show you what we're following in Michigan mostly. Now, it's a little bit different in that that guideline, along with a letter, allowed us to vaccinate 65 and over versus 75 and over. But that generally gives the best priorities scheme.
Okay, last one is quick one. It's my understanding that the stay-in-place recommendation did not address faculty and staff. Should faculty and staff be following the recommendation? Why were they not included? I'm going to shoot that one to Rob.
Sorry about that. Yeah, like we did in the fall, we targeted the population. And first off, is again example of collaboration with the county and the state health department. In this case, the county and our teams were working very closely on this and tracking where we're seeing cases. And we're seeing cases in the student population primarily. In the non-student population, it's been a plateaued. We're seeing increases in the students. It's a strategy that we've also seen that worked. It's at peer institutions have done similar kinds of sort of pauses, particularly at times when things were shifting and people were moving and things like that. And we saw it on our own campus last fall, where it gave us an opportunity to stabilize things and have things calm down. So it's really where we've seen the activity. And graduate students, I'd say, were included this time because the demographics of where we're seeing cases has shifted compared to the fall as well. At the time when we did the stay in place back in the fall, graduate and professional students accounted for about 3% of cases. Since January, it's been closer to 20%. So, I mean, this is how we're using the activity to sort of target the strategy.
Great, thanks. And again, living on campus is just a different kind of risk. And we think about our individual risk, but this is really about risk to the population. And when you live in a house with 20 people or 10 people, it's very different. So I'm going to end there, hand it back over to President Schlissel to close us out. Thank you.
Thanks, Preeti, and thanks everybody for their time today, their explanations, tuning in to the town hall. I know there's frustration, there's anxiety still. The vaccine's a double-edged sword, and we're all excited, but then the folks that haven't gotten it yet are very anxious about getting it. There's some oddities to the system, so a person might get it and their spouse may not. And that's comes from a random selection of an age cohort, for example. There are essential employees on campus that fall into big categories that might not understand why they got an invitation, but we're trying not to split hairs, because one thing we learned is if you try to make distinctions of who gets it, who doesn't, that's too fine, it takes a lot of time and creates a lot of confusion. So there are going to be imperfections in the system, but folks are doing the best they can using the guidance from the CDC as interpreted by the state, and it's going to change. So keep paying attention. So thank you very much, everybody. Please stay healthy. Have a good weekend, stay safe, and better times ahead. Thank you.